Imagine being born with a body that cannot move copper to where it is needed, especially to the brain. In just weeks or months, a baby can begin to lose strength, develop seizures, and become severely ill. This condition is called Menkes disease, a rare and life-threatening genetic disorder that affects copper transport in the body. Menkes disease is a rare inherited condition that disrupts how the body handles copper, an essential mineral needed for normal brain development, blood vessel strength, connective tissue formation, and energy production. Although some copper may enter the body, it cannot be properly absorbed, distributed, or delivered to the brain. As a result, many vital enzymes that depend on copper do not function normally, leading to progressive damage across multiple organ systems. Menkes disease is caused by harmful changes in a gene called ATP7A. This gene controls a protein responsible for moving copper throughout the body. When this transport system fails, copper becomes trapped in some tissues, while other critical organs, especially the brain, are deprived of copper. The condition is inherited in an X-linked pattern, which is why it mainly affects boys. Babies with Menkes disease often appear healthy at birth. Symptoms typically begin within the first few months of life and may include poor feeding, failure to gain weight, low muscle tone, developmental delays, seizures, low body temperature, frequent infections, and distinctive sparse or brittle hair. These symptoms reflect widespread disruption of normal biological processes due to copper deficiency in key tissues. Menkes disease is progressive and affects the brain early in life. Without effective treatment, neurologic damage advances quickly. Historically, many children with classic Menkes disease did not survive beyond early childhood. This makes early diagnosis and early intervention critically important. Diagnosis is based on clinical symptoms, low blood copper and ceruloplasmin levels, and confirmation through genetic testing of the ATP7A gene. Because the disease progresses rapidly, early identification can significantly influence outcomes. One of the most important principles in treating Menkes disease is timing. Treatment works best when started very early in life, ideally before significant neurologic injury occurs. The earlier copper replacement therapy begins, the greater the potential benefit for survival and development. ZYCUBO is the brand name for copper histidinate, a prescription medication approved by the U.S. Food and Drug Administration for the treatment of pediatric patients with Menkes disease. It is the first FDA-approved therapy specifically indicated for this condition. ZYCUBO is approved to treat Menkes disease in children. It is not approved for related but milder conditions such as occipital horn syndrome. The approval provides families and clinicians with a standardized, regulated treatment option for a disease that previously had no FDA-approved therapy. ZYCUBO contains copper histidinate, a form of copper that can be administered by injection under the skin. This method bypasses the gastrointestinal system, which does not absorb copper effectively in Menkes disease. The injected copper becomes available to the body, helping restore activity of copper-dependent enzymes and improving copper levels in the blood. ZYCUBO is given as a subcutaneous injection. Infants under 1 year of age typically receive injections twice daily, while children older than 1 year usually receive once-daily dosing. Treatment plans are individualized and require close medical supervision. Copper is essential for health, but excess copper can be harmful. ZYCUBO therapy requires careful monitoring of copper levels, kidney function, liver function, and blood counts. Infants are especially vulnerable to copper accumulation because their organs are still developing. Regular laboratory testing helps ensure safe and effective treatment. ZYCUBO was evaluated in pediatric clinical studies where treated children were compared with untreated patients from external control groups. Among children who began treatment within the first 4 weeks of life, there was a substantial reduction in the risk of death. Some treated children survived well beyond early childhood, whereas survival in untreated patients was significantly shorter. These findings formed the basis for FDA approval. This approval represents a major milestone for families affected by Menkes disease. It establishes an FDA-reviewed standard of care, improves access to a regulated therapy, and provides clinicians with clear guidance on dosing and safety monitoring. It also highlights the importance of early diagnosis and early treatment in rare genetic diseases. ZYCUBO addresses the underlying copper deficiency, but Menkes disease affects many systems. Comprehensive care often includes seizure management, nutritional support, respiratory care, physical therapy, occupational therapy, and coordinated follow-up with specialists in neurology, genetics, and metabolic medicine. Medication works best as part of a broader care plan. ZYCUBO is valuable because it delivers copper in a form the body can use, improves copper-related biomarkers, and has been shown to improve survival when started early. It does not cure Menkes disease, but it provides a meaningful opportunity to slow disease progression and improve outcomes when combined with early diagnosis and comprehensive medical care. In clinical studies, common adverse reactions reported in patients receiving ZYCUBO included respiratory infections, pneumonia, seizures, vomiting, fever, anemia, dehydration, breathing difficulties, injection site reactions, and abnormal liver enzyme levels. Many of these events reflect the medical fragility of children with Menkes disease, but they require careful clinical evaluation during treatment. ZYCUBO carries a risk of copper accumulation, which can affect the kidneys, liver, and blood system. Signs of toxicity may include metabolic disturbances and organ dysfunction. For this reason, treatment must be supervised by specialists experienced in managing metabolic disorders, with regular laboratory monitoring and clinical assessment. Parents and caregivers should discuss treatment timing, monitoring schedules, injection techniques, and warning signs that require urgent medical attention, such as worsening seizures, breathing problems, severe vomiting, dehydration, or feeding difficulties. Ongoing communication with the care team is essential for safe treatment. Menkes disease is a rare and life-threatening genetic disorder caused by impaired copper transport. ZYCUBO, an injectable copper replacement therapy, is the first FDA-approved treatment for this condition. When started early and combined with comprehensive medical care, it offers a meaningful opportunity to improve survival and support better outcomes. Early diagnosis, early treatment, and careful monitoring remain the most important factors in managing this disease. If you found this breakdown of ZYCUBO and Menkes disease helpful, support the channel by subscribing to Drug Insight Hub. We share clear, patient-friendly explanations of medicines, diseases, and new FDA approvals.